The opioid crisis has become a national epidemic.
I wanted to get out. I wanted another way.
Letanya Williams knows the dangers all too well. She's in long-term recovery and served time in prison.
I always knew that there was something greater. I always knew that it was something that I was supposed to do.
And that something was to share her experience as part of a new team in Lancaster County to tackle the opioid crisis. She's a certified peer support specialist at Counseling Services of Lancaster. The agency provides services to help address addiction.
That gives me a different perspective as the clinical counselor because I'm able to immediately and right way identify with a person that has had similar issues. I have it from being the person that was homeless, being that person that stole from family, being that person in and out the jail system, just being realistic to that person. You know, either you want to live or do you want to die?
Because Lancaster, South Carolina is a small community with a big opiate problem. Local agencies knew they needed a team approach for long-lasting solutions.
Here in Lancaster, we've really put most of our focus on it probably the last 3 or 4 years because that's when we really noticed an increase. The opioid is such a serious health problem. It's causing more deaths, it's causing more overdoses.
Opiates range from heroin to fentanyl, a synthetic heroin, to prescription painkillers. The Center for Disease Control says prescription opioids carry serious risks, and anyone can become addicted even when prescribed by a doctor. In 2017, Lancaster County dispensed 72.9 opioid prescriptions per 100 people, compared to 47.4 in neighboring Mecklenburg County. The national rate, 58.7. Lancaster County Sheriff's Office seized more than 25,000 pills, and that's not all.
The big problem we've seen over this past year is a lot of the heroin that we seized, only 16% of it was actually heroin. The rest of it was fentanyl. People just don't realize what they're injecting or putting in their body.
That it could be anything from heroin with a small mixture of fentanyl in it all the way up to 100% fentanyl, which is normally going to be fatal.
On the front lines of the opioid crisis, the medics who respond to every 911 call for an overdose, and that's why every ambulance carries Narcan. Narcan counteracts the life-threatening effects of an opioid overdose.
If we go back to 2016, we ran a little over 100 overdoses in Lancaster County. Last year we ran 279. It puts the medics in a stressful situation. A lot of times some of our overdoses are repeat patients. So you go out and you help them one time and then you go back and you help them sometimes multiple times.
Dispatch, EMS warning route.
Every overdose patient receives a visit 3 days later from a team that includes a peer support specialist.
It's a connection when a person that has been there, when I tell them I'm a person of long-term recovery, so I understand, you know, what you're going through.
Lancaster recently won federal grants of more than $2 million to beef up their team approach. Among other things, federal dollars will support law enforcement and first responders with increased staff, clinical support, and public outreach.
I'll be able to put a paramedic on the road 5 to 7 days a week, 40 hours a week, to visit opioid overdose victims and to hopefully begin some public education. We want to do awareness.
Really, the family wants them to get help. They just don't know how to go about it. And that's what this grant will do for us.
Counseling Services of Lancaster will hire 2 more peer support case managers, expanding the innovative program that sends teams to the homes of opioid abusers.
A lot of times people are just at the end of the rope and they don't know where else to go. It could be that they possibly don't even need our services. They may need links to other services, and that's what we hope the grant will do.
By steering addicts into substance abuse treatment and medical care, they're aiming to reduce overdoses by 20%.
This is not a get out of jail free card, but at the same time, you know, we do a pretty good job when it comes to enforcing the drug laws. We want to work from the other end and try to get these folks the help that they need.
Just to be able to help other people like me to understand that you too can overcome. You too can be successful.
We're very proud of recovery And, you know, we want that word out there. So,
You do have success stories.
yes, we do have success stories.
Because Lancaster agencies are taking a holistic approach to solve this public health emergency, and federal dollars have arrived to take this effort to a whole new level. For Carolina Impact, I'm Sheila Saints reporting.